Your mother takes ibuprofen every day for joint pain. Your father uses medication to control an overactive bladder. Your grandmother receives corticosteroids for arthritis, and your grandfather takes sleeping pills to rest better. 4 completely normal situations happening in millions of families. However, there's something you probably didn't know. Something that could change the way you view these seemingly harmless treatments. In recent years, multiple scientific studies have revealed a troubling connection between certain common medications and a significantly increased risk of stroke. We're not talking about rare or experimental drugs. We're talking about the ones you probably have in your medicine cabinet right now. Every year, millions of people around the world suffer strokes that might have been preventable with the right information and more conscious decisions about medication use. The difference between a safe treatment and a risky one often lies in details that patients are completely unaware of. This video is for informational purposes only and does not replace professional medical advice. Always consult qualified specialists for personalized guidance. Today, we'll look at 4 groups of medications that, when used incorrectly or without proper medical supervision, can triple the risk of stroke, show you safer alternatives and practical strategies to protect your brain health without sacrificing your quality of life. First, understand what happens during a stroke. Imagine your brain as a power plant that requires a constant supply of oxygen and nutrients delivered through a complex network of arteries. Stroke occurs when blood flow to part of the brain is suddenly cut off. There are 2 main types: ischemic stroke, ali 85% of cases, by a blood clot blocking a brain artery. Within minutes, brain cells start to die, leading to permanent damage. Hemorrhagic stroke, by a ruptured artery leaking blood into brain tissue, creating pressure and damage. Less common, but often more deadly, certain medications create the perfect conditions for either type to happen. By raising blood pressure, altering clotting, damaging artery walls, disrupting cerebral blood flow. Group 1 NSAIDs, non-steroidal anti-inflammatory drugs. These include ibuprofen, diclofenac, naproxen, piroxicam, medications almost everyone knows. They're available without prescription, used for decades, and seen as safe. But for older adults, especially over 60, dose use drastically increases stroke risk. A British medical journal study, I4+ million patients, found long-term NSAID use raises stroke risk 15–30%. If taken daily for over a week. A Danish study found diclofenac increased stroke risk 27%, ibuprofen 17%. Safer options. Manaf and paracetamol for pain relief in older adults. Topical anti-inflammatories, creams, gels with minimal systemic risk. Natural alternatives. Curve 101,000 Ejidars day with black pepper and ginger, both proven to reduce inflammation safely. Group 2 Anticholinergics for overactive bladder incontinence. Examples: oxybutynin, tolterodine, sulfonacin. These block acetylcholine, muscles, but also interfering with brain function. A JAMA internal medicine study I3000 seniors, 7 years, showed a 34% higher risk of dementia. Journal research found they increased stroke risk by 23%. Safer options. Beta-3 agonists like mirabegron, which relax the bladder without blocking acetylcholine. Pelvic floor cudgel exercises, bladder training, and lifestyle changes reduce caffeine, alcohol, maintain healthy weight. Group 30 corticosteroids, prednisone, dexamethasone, highly effective for inflammation, allergies, autoimmune diseases, and respiratory issues. But risky long-term. Journal meta-analysis, 700,000 patients showed 42% higher stroke risk after just 1 week, doubling after 1 month. They raise blood pressure, steroid-induced diabetes, worsen cholesterol levels, and thicken blood. A perfect storm for stroke. Safer strategies. Use the lowest effective dose for the shortest time. Explore inhaled corticosteroids or disease-modifying medications where possible. Monitor blood pressure, glucose, reduce sodium and sugar intake, exercise regularly. Group 4A antipsychotics, risperidone, olanzapine, quetiapine, originally for schizophrenia and bipolar disorder, now overused in seniors for dementia, agitation, sleep, or anxiety. These drugs carry the highest stroke risk, black box. Warning: nearly double the death risk in elderly dementia patients. Multiple studies show stroke risk increases 50–100% depending on dose. Alternatives: non-drug strategies, calming environments, consistent routines, therapeutic music, comfort, and clear communication. If necessary, use the lowest dose for the shortest time with regular monitoring. Important: never stop or change medication without consulting your doctor. Suddenly stopping can be just as dangerous. The goal is informed conversations with doctors. Is my current dose the lowest effective? Are there safer alternatives? Can lifestyle or non-drug approaches help reduce reliance? Protecting your brain naturally control blood pressure. Eat a Mediterranean-style diet, fruits, vegetables, fish, oil, exercise regularly. Even walking 30 minutes daily lowers stroke risk significantly. Stay hydrated, sleep enough, avoid smoking, and limit alcohol. Knowledge is power. Understanding the risks of common medications empowers you to make safer, smarter choices for your long-term health. If this video was helpful, consider subscribing for more science-based content on health and wellness. Share your thoughts in the comments. Your experience might help others. And don't miss our next video on natural foods that protect the brain and lower the risk of neurodegenerative diseases. Take care of your health, make informed decisions, and have an excellent day.